Welcome to Status, a game-changing product for electronic medical records management and patient engagement. We will now take you through some of the application's main functionalities. We will begin with a patient account. Notice the login is username and password based. After login, the application takes us to a system-defined default page, in this case, the patient profile. Here you can find general information about a patient's medical history, family history, allergies, and any other relevant information that may affect current or future health. To add new information, simply click on the Add Information Category button or click on an existing category name. Input your text and decide its visibility policy. If you check the Emergency Information category, then the information becomes available in the Emergency tab. Information in the Emergency Information tab is visible to all doctors and medical staff with a Status account. Any type of document, dataset, or record can be included in the Emergency tab. The medical record is core to Status. Here, all documents and medical investigations, including X-rays, CTs, RMNs, photos, and video recordings are consolidated. Where possible, Status automatically creates thumbnails of the records for easy navigation and identification. Also, it's possible to add medical events that contain all text information. For records created by the current user, you can edit their information and change access rights. Other visible records can only be downloaded or accessed for attached information. Finally, you can select multiple records and use them to create a collection of documents for sharing with other Status users, or even with users outside Status, based on their email address. A collection can always be edited later, including who is being shared with, access rights, and its contents. To improve health services and treatment effectiveness, Status employs its own medication management system. The web application works in tandem with the mobile apps provided by Status. The mobile apps deliver notifications for medication intake and feedback on treatment compliance, which can be viewed as a timeline. As a patient or doctor, you can view the medication history, current treatment, make changes to it, add a new medication, or completely change your current treatment. As a patient, you can schedule your medication administration hours based on your doctor's recommendations. Displaying health parameter evolution is another core feature of Status. Status maintains a list of all parameters with their respective medical values. Consulting one of these parameters gives all their available information, including historic values, graphic evolution, and the source of the information. In Status, there are a number of areas which are available to all users and can be made accessible to the general public without the need for any credentials. One of them is Healthcare Provider Presentation page, complete with a general description, contact details, and location information. It may also include quick links to mobile apps and other publicly available resources. The general public can also check doctor and medical staff information, which may include professional experience, schedule and locations, assistance, feedback from patients. If the patient is logged in and has been treated by the doctor, he or she may leave a feedback, which later needs to be approved by the doctor of healthcare provider in order to become visible to everyone else. With Status, it is also possible to make online appointments. Just search for your desired specialty, medic, or location. Select one of the free time slots marked in the calendar with green. Input any other relevant information, and you're done. Status comes with its own built-in messaging systems, available both online and through its mobile apps. Users can communicate with ease. They're notified when new messages arrive, have a history of all conversations, and can easily check the profile information of whom they're talking with. Finally, Status has a system for generating automatic notifications based on system events or administrator settings. Notifications can be configured to be received online, via email, or delivered to mobile devices. This concludes our presentation for most of the core functionalities that patients have access to. Next, we will discuss functionalities which are available only to doctors. Just like all users in Status, doctors access the application using their credentials. Access to different areas of the application is based on roles attributed to each user. By default, the application is set to take doctors to their consultation dashboard. Here, they can view the patients which are currently waiting in their office and quickly access their medical file. In the bottom half of the screen, doctors can view patients waiting for consultation and the duration in minutes, since they have arrived in the clinic. To close an ongoing patient visit, simply click on the flag next to their name and add any relevant information if necessary. Doctors have a number of areas which are only available to them, such as treatment schemes, patient search, and doctor profile. Doctors can view and edit their profile and add any other information they consider relevant for their professional experience. They can also edit their schedule and add out-of-office time. View and approve feedback comments from patients, and view their appoint history in patient visits. For ease of use, Status allows doctors to create treatment schemes. Adding a treatment scheme to a patient's medication automatically inserts the new medication with its timetable and dosages to the patient's existing treatment. Treatment schemes can also be made public and shared between doctors. Finally, let's see the doctor's view of a patient's medical file. Not all doctors can view a patient's medical file. Only those who are connected to the patient can access all information. Everyone else can only view the emergency information. A doctor is connected to a patient either manually by the reception desk or automatically the first time when the patient is confirmed to have arrived for a visit. You may notice that the medical record has a number of different records when viewed as a doctor. This is because of security and access rules, which control the level access for every user in the system. These are just some of the core features of Status. Apart from them, the application offers many other functionalities like a reception desk dashboard through which you can control, schedule, and manage current patient visits and appointments calendar, a specific area for management with reports on staff performance and business efficiency, and a user-friendly interface where system administrators can configure or modify many of the application's default settings. If you would like to learn more about Status, please visit us at www.status-online.ro. This concludes our short presentation. We hope you've enjoyed it. Status. Better healthcare services, better life.